Hello and welcome back to ALECtv. I'm Matt Fisher, and joining me now from Gingrich 360 is Joe DeSantis, the Chief Strategy Officer for Gingrich 360. Joe, welcome to ALECtv. How's it going?
Good. Thanks for having me on.
Awesome. So what brings you here to our annual meeting for ALEC?
I've been invited to speak to the Health and Human Services Task Force, and what I'm going to be talking about to the group of state legislators and everyone else involved is keeping healthcare dollars in your community. Right now, in a typical community, half of the money that your patients spend on healthcare, and that's not only that they spend out of pocket, but also what maybe their employer spends on their premiums, actually leaves the community. And it's because it goes toward large national insurance carriers that keep 25% of it. 10% is lost to fraud, which is pure theft in the healthcare system. And then also the fact that increasingly our healthcare providers, the hospitals, even if they say community hospital, they're actually owned by large health systems that are located not only out of town, but usually just out of state. All right? And so there are, though, some companies and communities that have succeeded in breaking out of this cycle of ever escalating costs and of healthcare dollars leaving their communities. But it really required them to rethink a lot of the assumptions about the way health insurance and health plans are supposed to work. And so what I'm going to be doing is sort of explaining the problem of what's going on, how the status quo health system actually leads to worse healthcare outcomes, because by removing dollars from the community, you actually remove funding for the social determinants of health that actually have a bigger impact on health outcomes than what happens in the clinic.
Right.
All right. And then what these communities, these businesses, or these towns have done to turn everything around and reduce their healthcare costs, get higher healthcare outcomes, and actually increase salaries and improve benefits as well.
Absolutely. Healthcare costs are such a big part of the national problem for families. And the number of medical bankruptcies tied to healthcare costs is insane. I have friends of mine in northwestern Georgia, rural Georgia, where the cost of healthcare blows my mind. So how can Americans like that, who are struggling with the cost of healthcare, who care, caring, compassionate, their friends and neighbors, how can they get involved with Gingrich 360 to help tackle these issues?
Go to the website, Gingrich 360. Gingrich 360 is a multimedia production and consulting company that is dedicated to the spread of conservative ideas. So we do a lot of writing on healthcare. We do a lot of audio. Newt has a podcast himself. It's called Newt's World. And then we produce other people's podcasts as well. So go there to find out, to learn more. But actually, the biggest thing they can do is start asking questions of their employer about how they choose their health plans, how much of that money is actually going, how much they're actually contributing to the health plan, and then start asking them, well, what if I actually wanted that money myself? All right, you can put that money into an account, and I buy my own plan on the individual marketplace, or maybe an indemnity plan, or use it for a Christian sharing ministry, or some other alternative arrangement. Start planting the question in their employer's mind about maybe we ought to be giving our employees a little more freedom, choice. Or actually, maybe we ought to start explaining to our employees exactly how much money is going into their healthcare plan. Chances are you'll start triggering conversations in their head. What's in their head about, wait a minute, we've been accepting 4, 5, 6% increases year over year in healthcare costs and the cost of health coverage, and we just shrug it off and assume it is, that there's nothing we can do about it. Whereas if there was any other line item that was increasing that much every single year, you guarantee you that CEO would be tearing things apart, trying to figure out what is going on.
Absolutely.
Starbucks spends more on healthcare than they do on coffee beans. GM spends more on healthcare than they do in steel. All right. Whether you like it or not, if you're an employer, you're in the healthcare business.
Right.
All right. And it's time to actually start asserting control over healthcare costs.
Yeah. Well, Joe, thank you so much for joining us on ALECtv. As someone who has family members who have dealt with high medical costs, it's great to hear the actions being done there. And I know tens of millions of Americans as well appreciate what you're doing. Thank you so much for joining us today.
Thank you.
And thank you to our listeners and viewers from ALECtv. Be sure to stay tuned for more from our annual meeting here in Salt Lake City.